different teachers do lots of presentations with their students, and we considered that this one was really interesting, especially because, well, we've never been in a situation like this, but in case we happen to be, at least to know what we should do and what we shouldn't do at all, okay? So, with the help of Pedro, that he has allowed us to record him, to invite you and everything, we are going to try how it goes. This computer goes very slowly, so the presentation had to be changed in the very last minute. So we need a little bit of patience just to move from slide into a slide, okay? From one to the next one, all right? Yes. And we have also Laura, who is a nurse, okay? She's going to be the dummy, okay? Yes? So he's going to practice. I think he's very happy. He's very happy with that, okay? Practicing with such a beautiful girl, all right? Yes? Thank you very much.
Okay, so as Isidro said, my name is Pedro, and we are talking about cardiopulmonary resuscitation. From now, CPR is the word, the letters to resume that. We are using cardiopulmonary resuscitation when we suffer a sudden cardiac arrest, which means that the heart, our heart, stops working automatically. So we stop, we don't have pulse, we don't breathe. But with cardiopulmonary resuscitation, we are substituting those problems, but not the problems of the computer. When we are using cardiopulmonary resuscitation, when the sudden cardiac arrest happens, but not in all conditions. It's when it happens unexpectedly, when we don't expect that it could happen, and when it's potentially reversible. So when the person who has had a cardiac arrest can survive with our intervention. Well, as I said, the CPR is the only treatment for a cardiac arrest, and we substitute the automatic pulse and the automatic breathing of the victim until he could do them on his own again. Well, to start to perform a CPR, we need to follow some steps. They are made by the chain of survival, as you see. The first one is the early recognition and call for help. We have to identify when a person has a problem, a heart problem, and call the emergency as soon as possible. If the cardiac arrest happens, we have to start CPR. That's what we are going to explain here. The first link of that chain is the early defibrillation. Perhaps you have seen in malls or in gyms or in airports that there are defibrillators in those areas. I don't know if you have seen them. You can use them without problem. They are very easy to be used. And I won't explain that here, but when you use an automatic defibrillator, you just have to follow the instruction that it said, and you don't have to make anything. It's very, very, very simple, and they just work when they know, when the machine know when they have to work. If it's not necessary defibrillation, they won't work. And the last link of the chain is the post-resuscitation care, which are made in a hospital, in an intensive care unit, and it's more specialized. But the first link is the early recognition and call for help. It's the start of the CPR. If we don't call the emergency, all the job that we will do later will be useless, because nobody will know that we have a problem there. The second link is the early CPR. Okay. Before anything, we have to make sure that we are working in a safe area, that we don't have any problem, or for example, if we are in a car accident, that another car could come and have another more serious accident. Because before anything, we have to be sure, we have to make sure that we have called the emergency services. Now start with the CPR. First of all, we have to check the victim for a response to see if he is conscious or if he is unconscious. If he is conscious, we shout him or we hit it softly. If he is conscious, we will leave the person in this position. If there is no danger, if he is in a safe area and he is conscious, we can leave here in his position. Try to find help if she or he needs it, and reassist the person regularly to check if he needs help or not. If he is unconscious, if we check for a response and he doesn't answer us, we shout for help to other people who could be around, and we open the airway to check if he is breathing, as we see in that picture. Normally, when a person is unconscious, the tongue falls down and then obstructs the airway, as you say in the upward picture. If we open the airway with a hand on his forehead, and you can say in the picture, and the fingers of the other hand in his chin, what is called the head tilted and chin lifted, we open the airway of that person, and if he is breathing, we can solve the problem was just with that. Then we will look the victim at the victim's chest for breathing movement, listen for breath sounds, and feel the air on your cheek, as you say in the image. You place your ear next to the mouth of that person, of the victim, and you look the chest for chest movements. Feel the nose and feel the air on your cheek, and try to hear if that person is breathing. If he's breathing, I don't know. No, it's not necessary. If he's breathing, we check like in the image, and if he's breathing, we turn him to recovery position, as in the image below, which means that when the victim is unconscious and he's breathing, we put him in a lateral lying, as you say in the image, so the airway is open, and if she puke, all the liquids that could be in her mouth and cause him an airway obstruction, those liquids can fall away from the mouth and let him to follow breathing. If he's not breathing, if we check that position and he's not breathing, we will call the emergency we haven't called before, and we will start CPR. We will not stop to check if he has pulse or not. Then we are starting in CPR in the moment that he stops breathing. How we start the chest compression? How we start the CPR? We will kneel by the side of the victim, and we place the head of a hand in the center of the victim chest, as you say in the image. Place the head of the other hand on the top of the first hand. We cross the fingers to not make pressure, in order to not make pressure on the ribs. And we start making 30 chest compression, like you see in the image, 30 times. After those 30 chest compression, we open again the airway to give him 2 rescue breaths. We pinch with the hand that we have in the forehead. We pinch the soft part of the nose close with our thumb and on our second finger of the hand of the forehead. We take a normal breath. We don't have to make a very big inspiration. We take a normal breath and blow into his or her mouth, making sure that we have a good CR. And we have to do it twice. We breathe normally, blow once, we breathe normally again, and blow the second time. And after that, we start again the CPR, the 30 chest compression, until the victim starts to move or to breathe, or he opens his eyes, or until professional helps arise and substitute us with that problem. And it's a kind of resume of what I have said. If the person is unconscious, we shout for help, we open the airway. If he's not breathing normally, we call 112. Start with 30 chest compression, then 2 rescue breaths, and then 30 chest compression again. And we repeat until professional help to arrive. And now I'm talking about another thing that I think that is important, that is the foreign body airway obstruction, which means that, for example, when you are eating and your airway gets obstructed by food or by whatever. The first thing that we have to do with that is to distinguish if it's a mild or a severe obstruction. If it is a mild obstruction, the person is able to speak. When we ask him if he is being choking, he will answer us. He will say yes by talking. He can speak, he can cough, he can breathe with problem. He will be suffering a bit, but he can breathe. And the only treatment for that, if he can speak and he can breathe, the only treatment is to encourage him to continue coughing. We don't have to touch him at all. If he can breathe, we just have to encourage him to continue coughing, not do anything else. Okay? And if it is a severe obstruction, the person is unable to speak. He cannot breathe, or he has a very wheezy breathing. He cannot cough, and he can be unconscious. By first he will be conscious, but then he can fall and get unconscious. What is the treatment for that? If he is conscious, we will start with 5 back blows. Now we are going to see it, and then 5 abdominal thrusts. And if with the moment that he falls unconscious, we are starting CPR, as we said before. We don't have to make other thing. When he falls and he is unconscious, we start the CPR. It's clear? Okay. And what do we have to do in a severe obstruction? First of all, stand behind or at the side of the victim. First, tilt his body forward and give 5 blows between his shoulders, as you see here. 5 blows between his shoulder. After each blow, we will have to check if we have solved the problem. We will have to hit 5 times him, just because I check that. We have to check if we have solved that problem. And if we don't solve that with the blows, it's when we are going to use the Heimlich, and perhaps you know that, or the 5 abdominal thrusts. We stand behind the victim, as you see in the image, and put our arms around his abdomen. Place one fist between the umbilicus and the rib cage, as you say in the picture, and place the other hand over it, okay? And then you push inwards and upwards 5 times. When we finish that, we start again with the 5 blows, and then with that, we are alternating the blows and the abdominal thrust. And that is all. If you have any doubt or something.
Pedro, could you perform that, the very last thing, with one person here?
Okay.
Just to see, because one thing is to see the pictures and another thing is to see it.
About the chair? For example, we stand behind and in the side of the victim, and we start to give, we tilt his body, and we start giving 5 blows between his shoulders. You see? And then, if we don't solve that, we place behind him, and with one fist between the umbilicus and the rib cage, and with our other hand over the fist, we push inwards and outwards 5 times. If I made it strong, I could make her puke, but make it, but more or less is what we have to do.
Okay. Thank you very much. Thank you.